Bismillahirrahmanirrahim. Assalamu alaikum. My name is Areej Iftikhar and I am a student of the Shalamar Medical and Dental College. The topic that I discuss is what is squint or strabismus. The contents that I discuss is what is squint, what is PSV, extraocular muscles, causes, symptoms, orthoptic investigation and treatment. So firstly we discuss the what is strabismus. This is the condition in which the eyes don't properly align, in which the eyes have different directions or different gazes when we see at different objects. So when the eyes align properly, we have normal eyes. But when the eye moves inward, outward, downward and upward, these are the conditions in the strabismus. When the eye moves inward, this condition is known as esotropia. When the eye moves outward, this condition is known as exotropia. When the eye turns downwards, this condition is known as hypotropia. When the eye turns upward, this condition is known as hypertropia. What is BSV? BSV is the ability to use both eyes simultaneously. It has three grades: simultaneous perception, fusion, strabismus. These grades are very important to see the things simultaneously so that each eye perceives a common single perception. Then we discuss the extraocular muscles. There are 6 extraocular muscles: medial rectus, lateral rectus, superior rectus, inferior rectus, superior oblique and inferior oblique. Now we discuss the nerve supply and the functions of these muscles. Medial rectus, superior rectus, inferior oblique. These muscles are supplied by the third nerve. Lateral rectus is supplied by the sixth nerve and superior oblique is supplied by the fourth nerve. Now we discuss the functions. Superior rectus performs elevation, adduction and intorsion. Inferior rectus performs depression, adduction and extorsion. Lateral rectus performs abduction. Medial rectus performs adduction. Superior oblique performs depression, abduction and intorsion. Inferior oblique performs elevation, abduction and extorsion. Then we discuss the causes of the strabismus, which may be congenital, which may be hereditary, result of any illness, long-sightedness, lesion in the cranial nerve, which may be a third nerve, sixth nerve or a fourth nerve, refractive error, which may be a high myopic patients, hypermetrop or astigmatism, injuries which may be a chemical, which may be exposure, which may be a mechanical, ocular diseases. Then we discuss the symptoms. Diplopia. Diplopia, this is the most common symptom in the patient of the strabismus. Eye strain, fatigue, headache, jittery vision, decreased depth perception. These are also the symptoms of the strabismic patients. Now we discuss the signs of the strabismus. The strabismic patients have closed eyes because the eyes do not properly align. They have in different direction or different gazes. One of the most featured that's seen in the strabismic patients is change in the posture, which may be tilting the head, which may be elevation of the chin, which may be a downward of the chin. So then we discuss the orthoptic assessment. There may be an objective test and subjective test. Objective test includes, this test is known as Hirschberg test. Hirschberg test, which may mainly describe the corneal reflection. Either the corneal reflection is central, either it is in limbus, either it is between the corneal margin and the limbus. This is the Pentorch test, so that we check the corneal reflection. This is the Kremsky test, in which the prism bar is placed in the fixating eye and now check the deviation in the deviating eye. This is a prism bar test. Now we discuss the subjective methods, which is Maddox wing, Maddox rod, synaptor 4. This is Maddox wing, this is Maddox rod and this is synaptor 4. Now we discuss the treatment, which includes the glasses, contact lenses, exercises, botulinum toxin. Botulinum toxin, this is the injection which is injected in the dominating muscle to paralyze its activity. Patching, this is very important in the amblyopic patient. And the last one is surgery. Thank you so much.